Physiology of pain. So transduction is the conversion of painful stimuli to an electrical impulse through peripheral nerve fibers that are called nociceptors. Transmission, on the other hand, occurs as the electrical impulse travels along the nerve fibers, where neurotransmitters regulate it. A pain threshold is the point at which a person feels pain. Pain tolerance is the amount of pain a person is willing to bear. Perception or awareness of the pain occurs in various parts of the brain with influences from thought and emotional processes. Modulation occurs in the spinal cord, causing muscles to contract reflexively, moving the body away from painful stimuli. So a few things here. It is important to break down, the differences between transduction and transmission, as well as pain threshold and pain tolerance. I've seen a lot of questions regarding those around like pharmacology in terms of, a patient's response to opioids. Additionally, I will go ahead and put up a graphic that will kind of go over the gate control theory of pain, which you might see pop up or have professors talk about it. Essentially, it's a theory that stimulating the spinal cord can stop some of the painful stimuli that a person's experiencing. So substances that increase pain transmission and cause an inflammatory effect, you'll definitely need to know these. Substance P, prostaglandins, bradykinin, and histamine. And then substances that decrease pain transmission are serotonin and endorphins. So some types of nociceptive pain. Somatic is in the bones, joints, muscles, skins, or connective tissues. Visceral, this is referring to pains in the organs, such as the stomach or intestines. It can cause referred pain in other locations separate from the stimulus. And referred pain just means like, the actual pain is being generated, let's say in my elbow, but I feel it in my left toe. That's a crazy example, but it isn't exactly where it feels like it is. So when you're talking to a patient, going over medical history, these are important questions to ask about pain. So you need to use anatomical terminology and landmarks to describe the location. Is it superficial or is it deep? Is it referred pain? Is it radiating? Then you need to go over the quality of the pain. Is it sharp? Is it dull? Aching, burning, stabbing? Just asking them, what does the pain feel like? And give them more than two choices. Is it throbbing? Is it burning? Is it stabbing? Ask them about the intensity and severity of the pain, which are measures of pain, using the appropriate pain scale. So for adults, that's like the 1 to 10. And then for young children, I believe the cutoff is 8 years old. I'll have to get back to that. Mainly for adults, you need to use the 1 to 10, because for children it is like I believe the FLAC scale, which just has the faces, since children of a certain age are too young to verbalize their pain or describe it accurately. So the pain scale of 1 to 10. So asking patients, how much pain do you have now on a scale of 1 to 10? Timing, you need to know the onset, duration, frequency. That's really when you do any kind of health assessment. When did it start? How long does it last? How often does it occur? You also need to go over like alleviating factors. Where are you when the symptoms occur? What are you doing when they occur? How does the pain affect your sleep? How does the pain affect your ability to work or interact with others? You need to document the associated findings, so fatigue, depression, nausea, anxiety, and then some aggravating and relieving factors. So what makes the pain worse? What makes it better? Are you currently taking prescription, herbal, or over-the-counter medications? Those are super important questions because, you know, OTCs and herbal medications can have pretty severe interactions with other drugs, so it is important to know.